Hello, I'm Dr. Aditya Bhati. I'm a consultant neurosurgeon and a spine surgeon at Indraprastha Apollo Hospital in New Delhi. Today I'll be talking about brain tumors. Brain tumors can present at any age, from childhood to the elderly age. The main symptoms of brain tumors are constant severe headache, vomiting, and other symptoms associated with are seizures and weakness of the limbs, speech disturbances, memory disturbances, facial asymmetry, and urinary and bowel disturbances. Whenever someone has such symptoms, one has to attend or consult a neurosurgeon. Accordingly, the neurosurgeon would advise for an CT, initial CT scan, just to see what is the reason for the headache or the other symptoms as I described you earlier. The initial scan would be a CT scan just to see what exactly is going on, and followed by a MRI scan to rule out the brain pathology. Brain tumors will be managed according to the size and location of the tumors. If it is a small tumor, it's a benign tumor, then it will be managed with radiation itself. Brain tumors require surgical excision. In today's scenario, there are different ways one can approach the tumor, starting from diagnostic tools to operative tools and post-operative radiation techniques. There are many technical advances where you can specifically localize the lesion, and microsurgically, endoscopically, you can approach with minimal cuts on the surface and can be efficiently, brain tumors can be managed. Following the surgery, the grade of the tumor is important because it will grade the prognosis of the patient. Biopsy of the tumor would be very important. It will grade the prognosis of the patient. Depending upon the grading of the tumor, the prognosis would be dependent. These days, with latest techniques, brain tumors can be managed more efficiently, and patient will have good lifestyle post-operatively and can go to work as soon as possible if the tumor is of a low grade. Thank you.